right, Miss Brittany, could you please summarize your chosen approach to family therapy?
Yes, experiential family therapy focuses on emotions. By focusing on emotions, you are allowing things that are in the unconsciousness mind of the family rather than surface level. There's also an emphasis on the present, not the past. This is important because a lot of times families will focus too much on former hurts and emotions rather than focus on what is presently bothering them. However, there is a critique of this approach because not focusing on the past can be detrimental to the present problems. Sometimes present problems are caused by the past, and those therefore need to be dealt with first. The field is split into two approaches: unstructured absurdity and structured communication. By this, I mean there are some therapists in experiential therapy, like Carl Whitaker, where he based his approach off of absurdity. He kind of flew by the handle and he would not use structured techniques when treating families. However, there was also Virginia Satir, who rather did structured approaches. She had specific ways of dealing with families and usually led to growth with individuals and things like self-worth. The premise of the theory is that by consciously being aware of your emotions, the family is better able to cope with each other and achieve individualism within the family unit. The idea is to bring all those emotions forward and to not keep them hidden underground. A lot of times communications is the biggest problem with families. Also, in the theory, change is encouraged. Rather than being stagnant or trying to keep the status quo, this approach really encourages change to happen and recognizes that change needs to happen with an individual as they grow and develop into human beings throughout their lifetime.
Very interesting. What makes your chosen approach distinct from other approaches to family therapy?
Well, Virginia Satir, that I mentioned before, a forerunner in this approach, she did emphasize proper and effective communication skills. However, experientialism is one of the few approaches that differs from traditional approaches in that it is not considered talk therapy. Most traditional therapies like psychoanalytic theory involve a therapist talking with the client and the client talking back, or the client speaking to each other in family therapy. However, in this one, talk therapy isn't necessarily encouraged because sometimes families need more of a push. They don't just talk about their problems, and being in front of a therapist can actually delay those talks because they're not feeling free to open up or they're scared of what they might say to each other. So instead, experiential therapy techniques are designed to be hands-on approaches, such as play therapy that's often used with children. Play therapy can be anything as a child playing with dolls or the therapist asking them to draw a picture of their family, and that can tell you worlds of information about what they experience the family to be like. Carl Whitaker, another therapist within this approach, often had his clients perform acts that were considered absurd in the therapy world just because they didn't seem to have relevance to the approach. However, things such as arm wrestling between a father and son would show underlying problems that they might be having. Also, the focus, again, is on the present, not the past, and a lot of approaches, again, like psychoanalytic theory, focus more on the past than the present.
Very interesting. What drew you to this approach personally?
Well, I personally like the idea of using non-conventional methods to help a family. I don't believe talk therapy is effective when it comes to family units. I think it can be great for the individual, but when you bring in a family unit, talk therapy isn't always the best. Certain family members may not want to open up in front of their other family members. And so in the way that experiential family therapy works, having something that is hands-on or having something that is more interactive, like play therapy, or using props like rope to bring the family closer together is a really great eye-opener for families to understand how they work and operate, and also if there are any dysfunctions within that family. I also like the growth of the individual within the family whereas other approaches might focus solely on what is best for the whole of the family, sort of a Gestalt theory. The experiential therapy allows for individualism, which I think is important because individuals need room to grow even within their family. The marker of a great functional family is having individuals that work properly together. Also, this theory emphasizes self-worth, mostly through Virginia Satir. She grew up very much like an outsider, and so she approached family therapy in the way that everybody needed to have self-worth and feel valued. Also, one of the great things about this approach is that rather than the therapist be a blank slate of sorts to project the family's needs and wants and dysfunctions onto, like you would in psychoanalytic theory, the therapist in this approach is really told to be creative. They have to have a big personality. In fact, the more involved the therapist is, the more effective this approach can be. So I like the idea that you're bringing your own personality to it. You're not getting lost in the family. You are bringing your own personality and your own drive, and you get to do a lot more hands-on work with the clients rather than just go by a set list of things to do.
Okay. How would you describe this approach in one sentence?
So I would describe experiential therapy as an exploration of unconscious familial emotions through absurdities and unconventions. I say it like this because the approach is really based on approaching the family in a way that does not make them feel closed in. It's not about being in an office and talking through one's feelings. It's about getting up and interacting with each other and growing together as a family rather than just talking at each other.
And Ms. Campbell, can you describe any key interventions associated with this approach?
Yes, I can. Family reconstruction is commonly used to bring to light family dysfunction. And the way that it does this is it has the therapist, with the help of the family unit, draw out a map of sorts called family maps in a way that highlights the details of the different aspects of the family, including age, any divorces, any signs of addiction or mental illness, all the details and facts that surround that family that may have impacted them, including their birth order, because birth order is also emphasized in this approach to bring about why certain family members act a certain way. If you do this, you can see through multiple generations where there are multiples or commonalities, and there go forth and see whether or not you want to continue in this behavior. Has this behavior been productive or functional for your family, or is it time to change? Also, there's another way you can do that, and it's the family life fact chronology. It's just a way of, again, mapping details and facts about the family throughout generations. However, in this manner, you're writing it down in a list, and it's in order. So you can see everything laid out chronologically in order to assess and evaluate how the family should carry on from there.